5 years ago today, South Africa was put on lockdown, and remember, it was supposed to just last 21 days, but what followed were very strange times. The way people gathered, reported for duty, shopped and attended church changed completely. Who can forget the president addresses to the nation, which soon became known as the family meetings? While all of this was happening, the impact on mental health and the economy soon became a reality. SADAG Call Center Manager Tracy Feinstein joins us now for this conversation. Tracy, good evening to you. Thank you so much for your time. 5 years ago, the streets were silent, a time that revealed the fragility of life as, people were laying to rest their loved ones, in some cases without the support of many of those that they trust the most. This was traumatic, especially for a number of people, which took a toll on their mental health. As you take stock then and now, would you say people have recovered?
Yes, good evening to you and to the viewers. I think there are so many ways that we can't just unpack this in a minute. And I do want to take time to reflect 5 years ago where this all started and how our world changed. SADAG in particular realized, definitely not to the extent that we thought it would happen, but we knew it was going to impact people's mental health and their lives, and of course their physical health. Very quickly we were able to go into a remote environment, and I must say I remember so clearly the first few months there was still an element of excitement, the unknown. But a lot of our calls were around relationship issues. People were phoning and they were saying, I'm not used to having my wife or my husband or the children in the house 24/7. Our world was disrupted. And we all had to learn new ways of being patient, being kind, and learning to work together. Unfortunately, as the time continued, I think the levels of anxiety continued to rise. And this is where there was certainly a trajectory to where we are now today. It's placed the spotlight on mental health, which in many ways is a good thing, because there is help available and we can look after our mental well-being. But I know that anxiety levels were incredibly high at the time. And when anxiety is high, it manifests physically. People don't know what's going on with themselves, and depression started to hit in. And if we look as to just by our call volumes that have grown exponentially over the last 5 years, prior to lockdown, we were fielding 600 to 800 calls a day. We're now anything between 2,700 and 3,000 calls a day.
Sure.
Which is great because people are reaching out for help. And I think that's the message we want to keep on giving. Hope is available. Hope is there and help is available.
And when you talk about, hope, and especially because it's always good to know that there's someone on the other end of the line who's able to receive your call and really just give you a sense of hope. Are you finding that people are coping better now with their families 5 years on?
I don't know about that one. I'm not a relationship person. But I do think that, that it was a unique situation, a real tragedy, but it really did allow us to spotlight mental health. And where we are now today, a lot of people are battling. The previous insert and conversation, which I caught the snippets of, really talks about unemployment. And that is devastating. People who do not have purpose battle with their mental well-being. It's impossible to wake up and feel good when you don't feel you have a purpose, when you don't have financial needs to take care of your family. And that is incredibly concerning. So we have this dilemma. We have this real pandemic at the moment because together with the state of our healthcare system, which is not great, we have a lot more people that are getting to realize that looking after their mental well-being and their health is so incredibly important. And the resources are pretty stretched at the moment. So I think it has got worse, but the good news is that it's probably seemingly got worse because more people are calling for help, and that is a good thing.
And I think it's really a good thing, especially when you reach out and you certainly aren't alone and you are, a bit overwhelmed. Would you say that, some of those calls included young people who, for them would have been either overwhelmed or bearing the brunt of one thing or the other, and sometimes can be missed by some of their parents when it comes to some of their struggles?
Exactly. That lockdown period put a spotlight on how many child-headed households exist in South Africa. And we certainly are finding that more and more youngsters are reaching out. We're talking about a generation 12, 13, 14, up to the mid-20s that are very aware of the topic. They understand that it is their responsibility to learn about mental health, and they are very comfortable with the conversation. And very often we find that we now have to bridge the gap between the adult generation and the youngsters to make them realize that it's a conversation. There are very specific tools and resources that you do need to activate to take care of your mental well-being. But yes, more and more young children are phoning us, and it's heartbreaking when we hear that children are battling and they are feeling so isolated. And of course, they're challenged with social media. So this is good to put the facts out.
And definitely social media, quite an impact there. But thank you so much, Tracy. I appreciate your time and really just talking to us and taking us back in time to some of those moments during the lockdown, some serious ones and really some, at least, humor that we saw, of course, during this time. But appreciate your time. That's the call center manager there at SADAG, Tracy Feinstein, talking to us about the 5 years since South Africa had the lockdown, which was declared on the 27th of March in 2020.